Welcome to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskfield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
Well, today we have with us Director of Human Services for Weld County, Jamie Ulrich. Jamie, thank you so much for being with us today.
Thank you so much for having me, Heidi.
So what we want to start off with is having you talk about your role. Not everybody understands as a Director of Human Services for a county here in Colorado what you do. So could you just start off by walking us through what your day-to-day job entails?
Yeah, absolutely. I think it's important to note that not all county departments of human services in Colorado are structured the same. So we have our mandatory programs, that's what we call them. And that really includes kind of all of our economic supports or our safety net programs. Child support, that does include our child welfare programs. But then there are other programs that some counties implement within their departments of human services and some counties don't. So that would include our workforce center. We have that under the umbrella of Weld County Department of Human Services. We also have the case management agency, which helps older adults and folks with disabilities get on Medicaid waiver programs. We also have our area agency on aging. And so that makes us a little unique in Weld County. So our overall goal in having all of those programs under one roof, under the Department of Human Services, is really to support all the members of our community. So this includes children, families, older adults, people with disabilities, and really help them with the overall needs that they have within their family and just help them thrive in the community.
Yeah. What drew you to this work? Your job is not an easy one. So share more about what took you down this path. Why do you do this?
Yeah, that's a great question. I actually started, 27, maybe 28 years ago now in 1996. I came into Weld County Department of Human Services as an eligibility technician and processed benefits for, we called them food stamps at the time, Medicaid, and some of the cash programs, and just really loved the direct service and the direct ability for me to help the people in our community. It just really landed on me, and it really became my passion to learn more about the work we do in human services and continued up the ladder to gain more and more knowledge and experience in all of the other programs. I did have the opportunity for a period of 3 years to work for the state of Colorado at the Colorado Department of Human Services so that I could see the state perspective as well as the county perspective. And I really loved the state work and really seeing how all of the counties were structured, what their service delivery looked like. But I was really excited to come back to the county level because I live in this community and I love to work in this community and I love to see the impact that we have in the community.
So Jamie, say more about the most common front door for kids to enter into the system that you oversee and run. How do they find you or how do you find them?
Yeah, a lot of the kids that we see are referred to us by providers that they see on a regular basis, or it could be school, it could be daycare providers, it could be physicians or the clinics that they go to. It could also be law enforcement. We do get quite a few referrals from law enforcement when they recognize that there are some challenges that are occurring. So it could be from a variety of community partners that we engage with on a regular basis.
What Jamie's talking about here is this concept of no wrong door. It's something that effective systems are always striving to create, that regardless of where a child and family is turning up and expressing a need, that wherever that is, has the opportunity to be able to link up that child and family with the appropriate services. It's one of the cornerstone elements of an effective system of care, and it's what the state of Colorado is really hoping to accomplish through the work it's currently doing. Well, that makes total sense. By the time they have reached sort of your component of the equation, which means they're sort of interacting in between perhaps prevention team and or the different services that you oversee, and I'm sure there are a lot of instances where it's a combination of different teams coming together. What do you feel like are the most common barriers that really stand in the way of helping you, supporting you and your team members in supporting these children and youth and families? Like, what are you feeling consistently frustrated by?
I think the biggest thing for us is the lack of services and placements, and especially when we want to keep children safely at home, or when we want to place a child in an appropriate setting that best matches the needs of the child, just the general lack of services and placements. Our service providers have struggled over the last few years to find enough qualified staff to meet the needs of the children and families we serve. So the workforce shortage that I think we've all experienced also has been experienced by our behavioral health providers and our residential facilities. And I think we're making a little bit of progress in that area. I know there's been a lot of concerted effort to really address the workforce shortage, but there are still areas within the state that we don't have an adequate network of providers. So matching the need with an appropriate provider, I would say, would be one of our most common barriers.
And I understand that very clearly as, from an outsider's perspective. I think let's just take this to the perspective of your everyday parent who doesn't have to maybe worry about county versus Ray versus state. Could you just describe from your perspective and that of, the work you're doing in Weld County, what is the county responsible for when it comes to making sure that certain services are available versus the Ray versus the state? Like, who's on first and who's responsible for which element of this equation?
Yeah, that's a great question. That becomes a little bit of a hot potato sometimes. And we are really here to help navigate through the very complex system that is out there. But so is the Ray. And the Ray has the care coordinators and they also are here to help navigate through the system. So they may go directly to the Ray and get assigned a care coordinator and, bypass us altogether. And we love that. We love the Ray being able to just step in and be able to provide that care coordination and get the services they need moving forward. But how do you even know what a Ray is if you're just a regular person and you notice that you're a parent who notices that their child is experiencing some challenges and that they might need some services? And that's where we have really good relationships with our community providers. And we, are able to look at our community mental health center and all of the services that are available there. And if they're coming to us, we're going to do everything we can to refer them appropriately to the right providers in our area. And that really takes a lot of relationship building and us really knowing what we have and who those providers are and building those relationships.
From your perspective, who's ultimately responsible for making sure that the services themselves exist?
I think that if we're talking about behavioral health
Yes.
providers and
Yes.
behavioral health services, I
Yes.
think ultimately that would be the Behavioral Health Administration that is responsible to ensure that behavioral health services exist in all areas within the county. And I think that that, again, is a challenge with some of the workforce issues that we have, but we certainly can identify in specific regions what we are lacking and, really welcome those open doors of communication with the BHA to identify what those are. And I do think that they, will be able to help us meet those needs.
What's interesting about Jamie's comments here is the fact that when it comes to Medicaid recipients, only Medicaid is actually responsible and on the hook for ensuring that the appropriate network of providers and services is there to meet those needs. Jamie's talking about the Behavioral Health Administration because they are this overarching umbrella that has been charged with ensuring that people in Colorado get the behavioral health care that they need, but they don't have any actual teeth in being able to ensure that Medicaid complies. And when it comes to commercial insurance, the complexity gets even further watered down because the Division of Insurance has its own set of authority, and that only applies to a limited subset of commercial insurance plans as well. So the actual authority of the Behavioral Health Administration has some real limitations. And Jamie's comments, while insightful in that there is a hope that the administration can pull these things together to ensure that Colorado's kids get access to the providers that they need, there are real limitations that the Behavioral Health Administration has. When we talk about some of the increasing challenges that counties like Weld County are facing in supporting children and youth with respect to their behavioral and mental health needs, what are you seeing with regard to the landscape in this space? Are there more youth in need? Do they have higher levels of complexity? I mean, you've already spoken that it feels like there are definitely fewer resources available to support these kids, but can you say more about the sort of what the landscape looks like for the population of children and youth these days?
Yeah, we are seeing a higher level in complex trauma in our youth, and we're specifically seeing a higher level of things like self-harm, suicidal ideations. Then we are compounded by other factors such as aggressive and assaultive behaviors. Sometimes they have serious criminal and weapons charges associated with it. So that when this complex trauma and these behaviors are combined with criminal activity, it really makes it difficult to address and treat their mental health and their trauma. So, when we talk about the lack of providers, it is even more so when we have a combination of challenges that we are trying to work through. We have been working together between the state, counties, and providers to solve this crisis because we do believe that we are still in a high acuity crisis here in the state of Colorado. We have made some progress, particularly in the efforts to increase the number of high-level placements, but we have not seen an increase in our lower levels of care or step-down placements, so we really need to focus on that and get those alternatives in place so that we have other options other than the higher level of care. We sent 68 youth out of state for placement and treatment in fiscal year 22-23. And so that is an indicator that we still have a long way to go to solve the crisis. We should not be sending our children out of state in order to receive the services they need. And I think that's something that we've talked about quite a bit here in Colorado is how do we bring what's working in other states to Colorado so we don't have to send them out of state. And that is really, I think, a goal that we need to keep kind of front and center as we're moving forward.
The number of out-of-state placements in Colorado has been steadily on the rise, and it has a direct correlation to the number of beds and services that have come offline over the last decade. What's really shocking about this particular scenario is not just the number of kids that Weld County is talking about having to put out of state to receive services, but often what we don't talk about is the age and the impact on families. Think about children as young as 7 being shipped out of state, being separated by and from their families for weeks and months at a time. This creates long-term harm in so many cases, and it is so difficult to bring back trust between families and providers, and it's something that Colorado has struggled to really solve for and continues to lack an adequate sense of urgency. When you look at other states, Jamie, to that end, states who aren't necessarily struggling and maybe aren't having to send as many kids to other states, because I think you don't even have to spend time, right, talking about why that's a problem. I think we just the sheer number alone, and you're one county out of many, and the fact that we have that many kids who can't be served in your county is heartbreaking. And so when you look at other states and go, gosh, we're really invested in having state X, Y, or Z help inform what we're doing here, who do you point to, or who are you hoping that the state of Colorado and our Medicaid leadership team is looking to and thinking about partnering with as they're doing their work?
Yeah, I think that we have had a lot of success, and I'm only speaking for Weld County because really every youth has their unique challenges, their unique behaviors, and so the milieu of what each facility offers is different and based on what those youth need. But speaking for Weld County, we've had quite a bit of success with some facilities located in Utah. They have really been able to wrap services around and do applied behavioral health opportunities with those youth that we've been able to send over there. So I would like to, really dig in a little more and see why they are successful with some of the youth that we've had there and what we can do to bring some of their strategies back to Colorado, because the ultimate goal is to bring these youth back to Colorado. And when they're successful in another state and they are stabilized and ready to be brought back, and we don't have the supports for them here, we tend to relapse and have to find another placement, many times out of state. So there's some good examples in Utah. I think that there's some good examples. I can't think off the top of my head in some of the other states, but I do know that there's some really good models out there that we can certainly study and see if we can bring back to Colorado.
Do you feel like this many kids that you're supporting with high complexity needs and this many kids that require the kinds of services that are now having to be sought out of state, is this the new norm for counties? Is Weld County somehow unique, or what are your colleagues saying about this?
Yeah, I think that this kind of is the new norm. In Colorado, we have, the ability for providers to decide who they will accept and who they will not accept. And that certainly is their prerogative. Many times our youth that have really these complex behaviors have been to many of the facilities that we have here and are not welcomed back. And so, it is really getting to know what's available, not only within Colorado and building those relationships within Colorado, but also outside of Colorado and trying to figure out what would best fit the needs of our communities. So we really do have to become experts. When we have a youth in county custody, our county placement teams really are experts in knowing what facilities are out there, knowing what's available, not just here, but in other states as well, and really just trying to work hard to find the right placement for those youth. I think the other thing that we are kind of seeing as the new norm here in Colorado is that we are still having kids placed in those stopgap settings. So even with a lot of advocacy and even with some recent legislation that was passed, we have not seen the number of kids in stopgap settings decline. So that's kind of our new norm too, right? I mean,
Yep.
And what I mean by stopgap is, those youth that have to stay in county offices or hotels with county workers. They're staying in hospitals past their medical necessity time. They're remaining in detention longer because all of these reasons around not being able to find placement. And I just wanted to kind of throw out a couple numbers for you.
Please do. Please do.
The monthly average for youth in stopgap settings in 2023 was 69. And to date, in 2024, the monthly average for kids in stopgap settings is 72. So we are not seeing a decline in those stopgap settings as of yet. So that is something that we really need to continue to work on. It is not safe to keep kids in county offices or hotels for the youth or for the workers, and it's not appropriate to keep them in hospitals past their medical necessity date or in detention. So we really need to continue to increase availability so that we can reduce the number of those stopgap settings.
Right. Well, transitioning now to this conversation specifically about the EPSDT lawsuit with Medicaid and this large settlement agreement that the state now has to comply with. I mean, these numbers are exactly why this lawsuit happened, right? There were lots of different stakeholders saying this is outrageous and we're in a place where immediate action needs to happen. So when we talk about the lawsuit now and counties and county directors' involvement in this area specifically, a group of you got together and put together a huge reform bill this last state legislative session in an effort to essentially tackle very similar issues that the lawsuit also seeks to address and that we hope are handled in the work in the out years with this implementation plan. Can you talk more about the bill itself and what led to its creation?
I would love to talk to you about Senate Bill 59. For about 10 years, county directors and the Colorado Human Services Directors Association, we've been increasingly concerned about behavioral health in Colorado, and especially as it relates to the child welfare population. And we were witnessing over the years kind of piecemeal initiatives that were being moved forward, but there was no real coordination around what a comprehensive system of care could potentially do. We saw other states were having significant success in implementing systems of care in their areas, and we as counties decided we needed to take it upon ourselves to take action. The opportunity presented itself last summer during the Child Welfare Interim Committee work that was happening, and we contracted as counties with a national expert on system of care, and we drafted, as you said, a huge piece of legislation that would really create a comprehensive system of care here in Colorado. And really the goal of that bill was to create a single statewide coordinated children's system of care. We wanted to support children and families to access the necessary services and supports through a single point of entry and really to have no wrong door. Our belief then and still is that a child or youth should not receive different or less treatment just because they have different insurance or no insurance at all. And again, we really looked at other states and saw how successful their comprehensive system of care policies were and wanted to start somewhere here in the state of Colorado. And so the directors got together and we had bipartisan support from our county commissioners. We had wide support from county commissioners all over Colorado, and we had tremendous bipartisan support from legislators as well.
Which is saying something, because the amount of diversity in leadership when it comes to county commissioners alone in this state to get wide-reaching agreement on a topic is not an easy thing to do. So the fact that you had far-reaching, bipartisan, diverse perspective support is pretty telling about how big of an issue this is for every county in the state of Colorado. Can you say more about what happened to this bill?
Well, unfortunately, we were not able to get it passed last year. I think one of the major concerns was around the financial aspect of it. We were able to secure funding for the first year through the Joint Budget Committee and advocacy on behalf of the Joint Budget Committee members to really get it kind of up and going and evaluating the feasibility of what this could actually look like.
Mm-hmm.
I think there was concern around what the out years would look like in terms of cost of implementing the system of care and how it would intersect with what was happening with the settlement agreement. So all of that work was actually happening at the same time. So while we were not able to pass it last year, I think one positive thing that came out of it was we really got people talking about it. We got whole communities talking about what behavioral health looks like in their community. As I mentioned, we had commissioners that were saying, yeah, this is not just about our child welfare population, but we oversee our entire needs of the community, and we're seeing significant challenges. We had rural areas, urban areas that were coming together. And so elevating the topic through this bill was a positive outcome in my mind. And it really provided a framework for how we could potentially move forward in the future.
So now, given that, and I would agree, it was an exceedingly helpful body of work that I think is only going to make the work around the settlement agreement that much better and stronger, and hopefully that much more responsive to county needs. How are counties hoping that the state's work on the settlement addresses those issues at this point? Like, what are you sort of coming together and saying, here's the expectation? Like, is it sort of a 1-for-1? Like, we expect pretty much everything that we raised in that bill to be addressed in this body of work advancing the settlement agreement?
Well, we do think that the settlement agreement is a positive step in creating what could be the initial parts of a comprehensive system, because it focuses solely on the Medicaid population. And some of the other states that we evaluated, that's also where they started. They started with the Medicaid population. So we think that the elements within the settlement agreement that have initially been outlined are in alignment with some of the elements that we had within our comprehensive system of care. So we're hopeful that some of those elements will be implemented and implemented well for the Medicaid population, and then can be replicated for other populations down the road. We also need to think about the uninsured and the underinsured and what that looks like for all of the youth that need them. So that is one thing that we are really hopeful for. We're also, we understand that there is going to be a pretty big price tag on implementing the settlement agreement as well. So again, scaling it based on that Medicaid population will really help us evaluate what that would look like for other populations down the road, and can start potentially planting some seeds on funding in the future to add on those additional populations. But also some of the elements that are not included yet in the settlement agreement, they can be expanded upon and we can continue to grow. So we see the settlement agreement as a starting point and as a positive stepping stone to eventually get to our overall comprehensive system of care.
It's interesting that when you were talking earlier about sort of one of the biggest challenges for Senate Bill 59 was the price tag, and then you just mentioning that implementation of the settlement agreement isn't going to be cheap. I mean, I think a lot of us are increasingly concerned about how quickly and how deeply the state is going to get in its planning and implementation, recognizing that we're about to enter a very difficult budget season. I mean, you're hearing, the state's budget director and now members of the Joint Budget Committee coming into awareness of just how limited the state budget is going to be this year. And they're talking about cuts. It's not just like, how do we hold steady? They're talking about how they're going to have to be some pretty significant cuts. So in that kind of landscape, how are counties planning to sort of hold the state accountable in continuing to move this work forward despite that very difficult budget landscape?
I think that we showed with our work with Senate Bill 59 that we are not going away, and that we are committed to ensuring that this work happens and it happens well in the state of Colorado. I'm not an expert on the state budget, and I don't pretend to know where all of the funding is going to come from in order to support this work. But what I do know is that we will continue to look at how other states have funded their systems of care, what this looks like based on the Medicaid. I mean, the settlement agreement, they have to implement it within 5 years. So it's kind of something that absolutely has to happen. So seeing how that goes through, but we are committed to seeing this through. I personally am committed to seeing this through because I really feel that passionately about us improving access to care for all youth in Colorado. So the counties are not going away.
I appreciate the work that you and your colleagues are doing in this space. Jamie, if you had to sum up sort of what's at stake here, I mean, we say these numbers, 69 kids last year being stuck in places that they shouldn't be because they couldn't get the services that they needed, and already at 72, and we're not even through the year yet. What does that actually mean as far as what's at stake for these kids? What does it mean when 72 kids get stuck and they can't get what they need? And if the state doesn't effectively respond with this implementation agreement, what happens to these kids? Why does that matter?
It matters because if we're not able to intervene and treat and provide these kids what they need, it is going to follow them into adulthood. It is going to impact their future relationships, their families. It's a huge implication to how the rest of their lives are going to be. I would love it if we came to a point in Colorado where we had to reduce the number of high acuity beds because our comprehensive system of care was intervening early on with these children and youth when those behaviors are first starting and they never get to the highly acute stage. That would be a win in the state of Colorado. Where we're at right now, though, is we're not doing those early interventions. We're not providing those services early enough on. So we're having to place kids that are highly acute because we didn't deal with the issues early enough. And their entire future depends upon that. And that is what's at stake. When we have children and youth that are not getting their behavioral health needs met, they become adults with behavioral health needs. And I can't even pretend to talk about the behavioral health system for adults.
Yeah. That's a whole other podcast, Jamie.
That's a whole other podcast, and I will not be your guest on that one.
Yeah. Well, I can promise you I won't be leading it. Well, perfect sense to me. And are there any closing thoughts? Is there anything that you want to say about here's what Colorado, here are my closing remarks for the state of Colorado and our leadership partners at Medicaid as they're doing this work? Anything else you would say, things you're hopeful about, anything like that as a way to close us out?
What I would say is I am very hopeful that we can use the settlement agreement. It provides us a unique opportunity to begin creating a more comprehensive system of care. And if we can all come together and work on that using the elements within the settlement agreement, then I think collectively we can really make this happen. So I am hopeful. I am hopeful that the settlement agreement is very successful in Colorado and it meets the needs of our Medicaid children and youth. I'm hopeful that the BHA, and I'm really confident that the BHA is paying close attention to the settlement agreement work and will incorporate that into all of the work that they're doing and that we can really come together so that it is seamless for our families.
Thanks, Jamie. Well, I know we all recognize the critical role that you and your colleagues play in making sure that kids in this state have not just, services that they need in those acute spaces, but really in a way that allows them to thrive more generally. So thank you for the incredible work that you and your colleagues are doing, for the amount of commitment you all have to this body of work. And I hope you'll come back, because clearly 5 years is not a short-term horizon. This is sort of a marathon that we're all in together. And we hope you'll come back and talk to us about how you feel like this work is progressing, because we're really just now kicking things off. And it will be so important that we're all continuing to stay at the table and talk and make sure that this goes well.
Absolutely. I'm happy to come back anytime. And thank you so much for elevating this. It's such an important topic for us to keep talking about.
Well, thank you. Thanks, Jamie Ulrich, our Director of Human Services for Weld County.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.